Infertility can be caused by several factors. Firstly, female-related factors. So what are these? It could be anything from having issues with ovulation, so producing an egg, having issues with blockage of their fallopian tubes. Fallopian tubes are structures which are connected to the womb and the ovaries, and it carries the eggs into the womb or the uterus. So these could be disease because of infection or past surgery. There could also be, of course, issues with the womb itself. So the uterus it's where the baby grows. But if, for example, it's scarred or it has tumors in it or polyps, these are all contributing to having difficulty conceiving. Now, aside from issues, of course, on the women's side, men clearly also contribute to infertility. And of patients, I see that maybe men where perhaps their sperm count is not so optimal, so it's low for various different reasons, or that the sperm is not moving in the right direction or right, percentage of motility, so how fast and how well they move. And also, of course, sometimes men has issues with the sperm morphology, where the sperm doesn't look normal due to various different factors again. So male and female, but often also a third of the patients may have combined issues. So male contributing, but also female contributing. So these are some of the contributors of or factors causing infertility. But don't forget, however, that lifestyle is also very important. So having regular exercise, a good diet, really keeping healthy, taking the right amount of supplements to help with your health is all very important in terms of helping improve fertility. I think the question around whether fertility is contributed more by male or female is a very individual question. So in a couple, for example, certain couples may have more of a problem associated with men, the male partner, and then due to various different reasons that they've had medical issues, for example. Some of my patients, for example, I've seen had cancer treatment and so on, and that's affected their sperm quality. But of course, some couples come with predominantly female issues. And of course, some of these women may need surgery to help improve their condition, and others may need some medication or some tablets to improve their ovulation. So the issue around whether male or female contributing to the fertility problem is a very individual one. And clearly at a consultation, I would evaluate that, do all the right investigations and tests in order to determine what is the key issue in this particular couple or patient. The way to, most of the patients I see where they come to clinic because they have been trying for a long time. Now, the definition of infertility, if you look at the NICE guidance or National Institute of Clinical Excellence in the UK, and actually globally, worldwide, the definition is if a couple has been trying regularly over a 12-month period or longer and have not conceived. But of course, it's also important to realize that fertility is very influenced by age, particularly in a woman. So fertility decreases after 35 years of age. And, and it's important to realize if you're closer to 40 than in your 30s, then it might be useful to seek fertility advice earlier rather than later. In case you do need fertility treatment, then you are already prepared. So whilst most patients come after 12 months of trying, there are certain conditions or certain situations where I see patients earlier. Another one that's very common is the lack of ovulation. So patients who have no periods or very irregular periods or with polycystic ovaries, they do come to us much earlier, because of course, if you don't produce an egg, it's not going to happen in terms of conception. Now, fertility treatment has come a long way. The technology is highly successful. However, what we need to realize is that conception is never 100%. So it's really important to understand that there is this uncertainty around whether the treatment is going to succeed or not. So on average, in a patient who is young, you would see a 1 in 3 chance of success, potentially even higher than that. But of course, each patient's individual condition and context affects their success rate. So I would say fertility treatment such as IVF has come a long way and is indeed does work and has improved in its success rate, but there is still the uncertainty and whether that's going to be yourself or not. And so the support that we provide, now I provide as a doctor is really important, because this process is always a little bit like a roller coaster. And so it is important that, I make sure that your journey is supported. And how do we do that? We have counseling services. We use technologies such as medical apps in order to assist your journey, to make it easier and reduce the burden that you have in your journey, whilst you go through some number of fertility treatment cycles in order to get to where we need to go.